Luxating patella is an extremely common cause of lameness in dogs, particularly small breed dogs or toy breed dogs less than 30 to 40 pounds body weight. However, we do see them in dogs of all sizes. In order to explain what surgical procedure we perform to correct luxating patella, let's first of all look at a model of the dog knee. The dog knee is composed of several bones. We have the femur, the tibia, and then we have the kneecap itself. The kneecap is a very small bone that sits in the end of what we call the quadriceps tendon on the front of the knee. There is then the major portion of the tendon that runs from the kneecap and inserts onto a portion of the front of the tibia, what we call the tibial tubercle. The kneecap runs on a groove or railway track which is lined by cartilage on the end of the femur. What a kneecap luxation really is where the kneecap decides to dislocate off that groove during normal walking. So during flexion or extension of the knee, the kneecap dislocates off the groove, causing some degree of lameness and discomfort.
This is often a problem that we see in both knees. Often one knee is worse than the other, but it's not unusual to have to correct it on both sides.
When we are surgically correcting a patella luxation, there are several factors we need to evaluate. First of all, how deep is the actual groove where the patella runs? If this groove is very shallow, we may actually need to surgically deepen the groove to provide a better depth for the kneecap to run on the end of the femur. The second part of the surgical procedure is we need to evaluate how malaligned the patella tendon is in relation to the femur. In many of these patients, we'll find that the tibia is actually rotated or malaligned in relation to the femur. If that is the case, we are going to have to realign the whole patella tendon mechanism. How we do that is we actually perform an osteotomy or bone cut in the tibial tubercle where the patella tendon attaches. Once we have done this, we are able to actually lift that bone and rotate it in the direction that we need to realign the kneecap back in place. The bone is then stabilized in its new position with either small pins or suture to allow it to heal in its new location. The last part of the procedure is we need to tighten up the soft tissues around the knee to help keep the kneecap in place.
So you can see this leg is normal with the patella fairly central in the groove. On the other side, the patella is on the outside where it should be sitting right here. There's actually quite a bit of arthritis in this knee as well. The other thing you can appreciate a little bit on this view is you cannot really see the tibial tuberosity on the normal side, but the tibial tuberosity is actually rotated to the outside on the abnormal knee. And so here the goal would be to re-centralize this patella by realigning the quadriceps mechanism, and we do that through deepening this groove, moving the tibial tuberosity, the attachment for the patella tendon, moving that over to a more central position. And in this case, because it is such a severe case, we actually need to reconstruct some of the soft tissues as well. And so I'm going to show the post-operative view. So what has been done here is the tibial tuberosity has been cut and realigned, and pins have been placed to keep the tuberosity in place. The patella now, you can see it, you can actually see it on top of the knee. And then on the other view of the x-rays, you can see now that the patella is located centrally in the groove and the pins have fixed the tuberosity in a more central position. Usually this is a procedure that leads to a very good outcome. A lot of times these dogs will be lame on and off or persistently lame, and this usually leads to good function post-operatively.
Following surgery, it's very, very important that your dog stay extremely quiet for the first 6 to 8 weeks. No off-leash activity outside. Please make sure your dog is not running or jumping in the house, because all of these forces have the ability to cause relaxation of the kneecap. It's very important that you recheck with your veterinarian at a week and at a month so they can reevaluate and make sure your dog is doing well. Many patients will be using their legs within the first week, but it can take up to 8 weeks or sometimes a little longer before all residual lameness has gone.